Well, this unrelenting heat wave is raising major health concerns from dehydration to heat stroke. And in some cases, the heat could be life threatening if actions are not taken soon enough. So, for more on this, I want to bring in Dr. Hany Attalah. He's the chief medical officer at Jackson Memorial Hospital in Miami. Good to see you, doctor. These extreme temperatures, what are some of the ways to tell the difference between just being overheated and actually venturing into more dangerous territory like heat exhaustion or heat stroke?
So I think it's important to pay attention to your body and the signs and symptoms you may be feeling. So, feeling a little thirsty, sweating a lot, those should be your first indication that you really sort of need to get out of the heat. That can obviously progress to something like heat exhaustion, which is often accompanied by a headache, some dizziness, perhaps some nausea, weakness. That definitely ought to get you out of the heat. And then once we, progress to heat stroke, then you're confused. You may have seizures, convulsions, and that's truly a severe medical emergency, as previously mentioned.
So there's some people who, can't get out of the heat. They work outside. I look at these postal workers are carrying these heavy bags, all the way down the street. What can they do to protect themselves when they really don't have the option of just like settling into an air conditioned location?
As much as possible, it's important to stay hydrated. Drinking plenty of water. Knowing your limits. At times, if you need to step into a building or something where there's some air conditioning to get yourself cooled down. Taking frequent breaks and relaxing in a shaded area can certainly help as well. And then wear, light colored, loose fitting clothing certainly helps as well.
When it comes to heat stroke, once you are cooled down, once you've had medical intervention, I'm wondering if there are still long-term effects. I mean, does this have sort of a damaging effect on the body?
Yeah, with heat exhaustion, not typically, but with heat stroke, certainly it's a possibility. Heat stroke is really the body's inability to keep itself cool. With that can come, damage to the liver, damage to the kidneys, or neurologic damage.
Mm.
Sometimes those things can't be recovered from.
Listen, people still want to go out though. People are going to these vacation spots like Miami, and if you've already booked
Yep.
the vacation, you want to take full advantage of it. Is there anything you can do to sort of acclimate, to prepare for the difference in temperature, or maybe when the temperatures get into the mid 90s, just the human body isn't really built for that. So the only thing you can do is keep yourself cool. But is there a way to get used to the temperatures?
Acclimatization, which is what you're referring to, really takes a little bit more time. I think, again, it's really important for people to know their limits during the hotter parts of the day. Find something else fun to do. We certainly have plenty to do in Miami.
Hmm.
You want to obviously have a good time, but not too much alcohol. And it's very important to keep a good supply of water nearby. Again, know your limits. If you're very young age, very old age, have a lot of other medical problems, are pregnant, those are the people who really need to be more careful, and we need to keep a closer eye on. So, really trying to stay out of the heat during the peak hours of the day, I think is a good idea, but really knowing your limits, and acclimatization really takes some more time. So if you're visiting a hot area, really focusing on doing things to keep yourself cool if you're going to be outside.
All right, Dr. Hany Attalah, thank you so much.
Thanks, Anne Marie.